Addiction is the compulsive use of a substance and the inability to control its intake, despite the negative consequences that it has on one's life, work, interpersonal relationships. Symptoms of addiction are the inability to control the intake of a substance, the need to take more and more of that substance to achieve a desired effect. It would be one beginning to falter or avoid work or school, or having fights with a spouse, spending a lot of time to seek the substance, the inability to control the intake once one starts, needing more and more to achieve the desired effect. So OCD relates to addiction in two ways. The first being that both OCD sufferers and addiction sufferers are often trying to mitigate some emotional pain or anxiety. With OCD, you're doing that through doing compulsions in order to reduce the anxiety, and with addiction, you're doing that by taking the substance to decrease that negative emotional state. With OCD and addiction also, in the beginning, are often performed in secret, and that sufferers feel that they need to hide their symptoms and hide what they're suffering from, and don't feel the ability to share that. OCD sufferers are especially vulnerable to falling prey to addiction because OCD is a negative state, meaning that you're very anxious and they will obsess about certain themes or certain topics, and then you do your compulsion to remove that negative state or to try to decrease the anxiety associated with it. Addiction is very similar in the sense that you can use the substances for addiction to remove that state. So somebody who has OCD who's very anxious could either decide to take a couple drinks or use something like a Klonopin or an Ativan to reduce their anxiety. Alcohol and benzodiazepines work very quickly to reduce anxiety, which leads to a more positive state. However, the drugs wear off very quickly and then the negative state returns. Therefore, you'd want to take the substance again. So what happens with OCD, people who also have OCD tend to be obsessive and a bit compulsive in their behaviors in general. So it lends them vulnerable to this drug seeking and taking activity, which can also have obsessive and compulsive attributes to it. So the frontline treatment for OCD is SSRIs, which are selective serotonin reuptake inhibitors, something like Prozac, Zoloft, Luvox. These drugs have very low abuse potential, meaning you take them every day, they have very long half-lives, but they don't have high abuse potential. And they relieve anxiety or turn the volume down of your OCD over a long period of time. Shorter acting drugs like benzodiazepines, Klonopin, Ativan, Xanax are much faster acting. They also have a shorter half-life, which means they do a great job in relieving anxiety. However, they wear off relatively quickly in a matter of hours, which leads them to have a much higher abuse potential because people will take more and more of the substance or have to take it more often to achieve that desired effect. Effects of withdrawal, so any shakiness, any panic attacks when the substance wears off, finding oneself taking more than that was prescribed. So if your psychiatrist said to take 0.25 as needed, that is not meant to be every 6 hours. If it is prescribed to you in that way, that's a different story, but if you are finding that you're taking more and more and more of that substance than originally the doctor suggested, then you may be on your road to experiencing some signs of tolerance and withdrawal or addiction. Oftentimes people with OCD will self-medicate at the end of work, saying, oh, I had a particularly rough day, I've been dealing with my obsessions all day, I'm exhausted, I'm just gonna have a couple glasses of wine because I need a break from my thoughts, or I would like to go to sleep and have the volume of my thoughts turned down. So, or I'm gonna take a Klonopin tonight to relieve some of that. So sneaking or even just having them available to you. So oftentimes I'll have clients who refuse to get on an airplane without the safety or reassurance of having their pills with them for the just in case episode. So when you start to feel a reliance or a dependence that you need these drugs in order to function, and that without them you're going to have reduced ability to function, whether it's at work or at home or getting through certain events, then I would say you're starting the road down an addiction. I would hesitate to see an outpatient practitioner for treatment for addiction. There are several programs throughout the country that work with dual diagnosis in an inpatient setting, in a partial hospitalization setting, or intensive outpatient. What the protocol is to really stabilize the addiction first. So have the person abstinent from the substance before doing the OCD work, because when you're taking a substance that's going to reduce your anxiety, it's really hard to do some of the cognitive behavioral work or exposure work when the anxiety isn't present, or if the individual is drug seeking at that time. So you really want to treat the addiction first, or in one of these dual diagnosis programs before outpatient therapy, which can help more for coping skills, skill sets, identifying the triggers that may cause relapse or cause you to use again. If you're a family and friend, or family member or friend, feeling that somebody that you love is struggling with an addiction of sorts, the best thing to do is talk about it with them. Most likely you're going to be met with a high degree of resistance. Addiction is something that's very, very difficult to treat, and people tend to not get better unless they themselves are ready to confront that. So it is a challenging thing. Oftentimes you will not meet success the first time, but making yourself aware of it, making your family member aware that they notice a problem is the best that you can do. They're not alone. That this is something that you're naturally going to possibly fall prey to, in that it does work. It does work to relieve those symptoms, so a lot of people fall prey to it. So there's no shame in it. There's no, there's nothing wrong with you for doing that. And in many ways, addiction they're leaning towards looking at it from a more medical perspective, that it's a disease of the brain. And that it's not something that you are necessarily weak-minded, that it's because you didn't have enough control over it, that there's a genetic loading to it, and that it's more likely going to be more medically treated. So in a lot of ways, it's not your fault, and that there is help out there to get help.